Hello everyone. Today we'll be discussing the first part of patient assessment. Patient assessment is a systemic and logical pattern of assessment for each and every patient. Now, in front of you are two checkoff forms from National Registry. The bottom one is for a medical patient, and the top one is for a trauma patient. I want you to look at them and recognize that everything above the X are exactly the same. And that is 6. The first 6 are within the scene size up, and 14 points are within the primary assessment. So what is a scene size up? Scene size up is information you will receive while you're en route or just as you approach the scene. Now, everything always starts with personal safety, so you will wear your gloves, and after each patient contact, you'll wash your hands, and you will continually assess the scenes for hazards. And you will be thinking about the information you received from dispatch, such as the reason of the call. Was it a mechanism of injury, which means a trauma patient, or a nature of illness call, or a medical patient? How many patients do you have? Do you need additional resources to manage the scene appropriately, such as fire, police, or additional ambulances? And as you leave your ambulance, what equipment should you take with you? You will be going with a jump bag for all patients. However, do you need to take a C-collar and a long spine board? If it's trauma patient, that would be highly recommended if there's damage to the head, neck, or back. However, it would get in the way if you have a medical patient. You will receive the next 3 points simply by assessing the patient when you first lay eyes on them. For example, here is a picture of the patient in the white shirt, and you can guess his age, weight, gender. You can recognize that he is standing. You can recognize that he is awake to you. He is watching you with his eyes as you approach. And you can ask him, why did you call 911? Is your stomach bothering you? Are you having chest pain? Are you vomiting? Any shortness of breath? Why is EMS here at this time? Whereas this patient, when we walk toward him, he is not awake. So we have to identify if he will respond to verbal or painful stimuli. Then we have to look for obvious life threats. Is his airway blocked by blood or vomit? Is there chest trauma that we cannot see from this position? Is there any uncontrolled bleeding? Then we will start with our A, B, C, D. We will open up an airway and make sure that it remains open, and if we have to, we can use tools such as an OPA or an NPA. We're going to look at the chest and make sure that the chest is rising and falling. We will assess the rate. We will consider giving him oxygen and managing any injuries that we note at this time. We will assess the skin condition as well as while we are getting a pulse. Is the skin, we will assess the color, the temperature, as well as the condition. And if we need to, we can start shock management if the patient is unstable. If they are unstable, we will consider it a load and go situation. The patient needs to get to the hospital as quickly as possible. But if the patient is relatively stable, we can stay on scene and make the patient more comfortable before putting them in the back of the ambulance. Now, there are 42 points to patient assessment, and we have covered the first half following these simple rules. Master these first before we get into any other information. Thank you very much. Have a nice day.